Hello everyone, welcome back. I am Dr. Alexandra Mayer, and if you are new to my channel, welcome. If you've been watching my channel for a while, I just want to say thank you. I have had so much feedback this last couple weeks on how much the videos are helping women, and how much information they get from it, and how people are sharing it with their friends. And so I just really appreciate that, and I just want to say thank you, because if you've ever created content, you know that creating content is challenging sometimes. It's challenging to be inspired and to know what to talk about. And so knowing that it helps people is wonderful for me. So I really appreciate that. Today's topic is a good one. And I think it's something that we don't talk about enough. And today we're going to be marrying GI concerns, some of our common GI concerns, with some of our hormone imbalance. And we did do this in previous videos in our estrogen metabolism series, right? Because we know that phase 3 of estrogen metabolism is it has to go out through the GI tract, and we know that the GI tract can wreak havoc on that. But what about other common GI concerns, right? How does that impact the way that we utilize our hormones? How does that impact the way we make our hormones? And how does that impact the way we metabolize our hormones? And so, as you can tell, this is a big topic, but we're gonna kind of dive into it today. So we're thinking about common GI concerns. I am aware that there are a lot of GI concerns, right? There's things like parasites that we can pick up. There is imbalances in normal good flora, and then there's Candida, SIBO, there's heartburn, there's H. pylori and ulcers, and then there's food sensitivities. We're not gonna be diving into all of that. We're gonna be going into like 3 of, I think, some of the main common concerns when it comes to the GI tract. And the first one is going to be changes in stomach acid. So actually low stomach acid. Yes, I said that, low stomach acid. It's funny, this is called hypochlorhydria. So it's a low amount of HCl produced in the stomach, and it really wreaks havoc on the way that we metabolize things, and on what gets into our GI tract as we're eating and as we're digesting our food. So when we're thinking about that, oftentimes this shows up like in digestion, right? So like chronic heartburn is usually low stomach acid, and it goes completely against the way that we treat it conventionally, right? Because we're treating it with proton pump inhibitors, which decrease the amount of acid. What's interesting to think about is that when we think about stomach acid, we think about the stomach, and then at the top of the stomach there's a sphincter, and it's called the lower esophageal sphincter. And that sphincter is activated by acid. So if you have enough acid, that sphincter will actually tighten, and so things can't go back up. If you don't have enough acid, that sphincter doesn't tighten, and so we end up with symptoms like heartburn. So oftentimes patients who've had chronic heartburn walk in our office and they're like, look, dude, I've tried everything. And increasing their stomach acid has never been tried. So why do we care, right? Well, we care a lot about stomach acid because stomach acid is meant to kill things. It kills things that goes through your GI tract. And so when we're eating things that are like yeasty, or things that have some bacteria in it, not necessarily bad bacteria, not necessarily pathogenic bacteria, but that can change our gut flora a little bit, we're expecting our stomach acid to do what it needs to do and kill that off, right? The other things that we think about with this is we think about it in terms of ulcer creation, right? Because when we get an ulcer that is a bug, it's H. pylori, and H. pylori will lower our stomach acid production naturally because it wants to keep itself alive. And then we think about it in terms of the nutrients we absorb. So things like B12 requires your cells that make HCl to be active and working. And then zinc, you have to have enough stomach acid to create zinc. And you'll remember maybe way back when in one of our very first videos, we talked about testosterone and how testosterone requires good amounts of zinc. Spoiler alert, so does thyroid. So when we think about these hormonal imbalances, right, we need to think about that nutrient piece, and then we need to back up and say, can we even absorb our nutrients? Well, absorbing your nutrients starts in your stomach. It starts with good stomach acid. One of the best ways to start treating this, or thinking about treating this, is to do a little bit of apple cider vinegar. A little bit of apple cider vinegar and water every day can be a really great way to see if that is helpful. And then if that makes you worse, you may want to move on to our next topic, which is yeast or Candida. So when we think about yeast, right, we are thinking about an overgrowth. Everybody's gut has a little bit of yeast in it, but what we're thinking about is an overgrowth of yeast. Oftentimes we think about these in terms of locations on the body in terms of yeast infections, right? So maybe you have thrush, so a yeast infection in your like mouth or you might have a yeast infection rash in like your folds on your leg or something like that in your groin area, or athlete's foot, or vaginal yeast infections. All of these things come up, and usually we treat them just like that. We treat them like a localized yeast infection. We throw the treatment at you, be it topical or oral, and then we go on our merry way. Well, what we know is that yeast is a very opportunistic bug, right? So like I said, it's normal, but it's very, very opportunistic. And so it will grow if it has the ability to grow. So if our normal flora is a little bit less diverse than we expect it to be, we tend to grow yeast. So what are our yeast symptoms, right? Well, we think about constipation with yeast. Yeast is a very, very constipating bug. And it usually does have some sort of gas and bloating with it. With that, we also see this in patients with interstitial cystitis is common, prostatitis is common, brain fog is really common with Candida, and then fibromyalgia and chronic fatigue can also show up with this. With Candida, what we think about is we need to look at the amount of antibiotic use, because we do know that antibiotics set us up to have more yeast overgrowth. And then in women, we do look at things like vaginal yeast infections. So if you're that patient that has chronic vaginal yeast infections or chronic BV, oftentimes that can need to be treated at the gut level, right? Usually we need to treat that at the vaginal level as well, because nobody likes those symptoms, but we often have to treat that at gut level. So how does this play a role in our hormones? Well, there's a couple different things. So first of all, yeast has receptors for estrogen. And the reason why this matters is because if you're on an oral contraceptive or HRT that has estrogen and your symptoms are getting worse, your gut symptoms are getting worse, Candida can play a role in that, because those medications can really, really alter Candida and make it more virulent or more aggressive, I guess. The other thing with Candida is that Candida will actually cleave off what your body puts on to be able to metabolize out that estrogen. So your body packages up that estrogen all nice in the GI tract, and then it's supposed to take it out. Well, Candida can actually unpackage it so that your body can reabsorb that estrogen and use it again. It also will create toxins that go back to the liver and slow your liver's metabolism of things. And when I say things, I mean things like estrogen and things like hormones. So oftentimes you can really experience changes in estrogen and those estrogen dominant symptoms with an increase in Candida. And changes in estrogen can amplify that Candida, so they go back and forth. For me, with treating Candida, right, we want to do a symptom questionnaire. We may want to do a stool test. Oftentimes that's not necessary, it might be a little bit overkill, but something to consider, especially in chronic cases. And then we want to really properly treat this, right? So you need to kill it, you need to make sure that you're repopulating that good gut flora, and oftentimes talking about that Candida diet so that it doesn't come back. So that's our second kind of gut infection that we're talking about. Our third gut infection that we're talking about is SIBO. And again, this is an opportunistic infection. What that means is that it's not necessarily a pathogenic bacteria. It's normal bacteria. And it's normal bacteria that lives in the large intestine, is normal in the large intestine, that backs up into the small intestine or gets into the small intestine in some way and then populates. So SIBO stands for small intestine bacterial overgrowth. And the hallmark of SIBO is bloating. Bloating and gas. Bloating and gas all the time. They're really not worse or better with different foods. It's pretty consistent. Usually they're the kind of bloating that like in the morning they might be okay before they've had anything in their system, and the minute they put anything in their system they get gas and bloating. The reason why is because these bacteria in the large intestine get first pass at everything we put in our mouths and they turn it into gas. And so that's why we end up with those symptoms. You can have diarrhea or constipation depending on the bug created, and then you can have a host of other symptoms. So there is a correlation between anxiety, changes in mood, acne, all with small intestine bacterial overgrowth. So it really is something that we're looking at. If you've been diagnosed with IBS, IBS is basically a diagnosis of we don't really know what's going on and we're not going to give you a proper diagnosis. So oftentimes in those cases, SIBO plays a big role. Again, our hormones play a big role in SIBO, and that's because things like oral contraceptive use over the course of years will change our gut flora and makes us more susceptible to SIBO. On top of that, right, changes in our stomach acid also will make us more susceptible to SIBO. With SIBO, we also want to think about the migrating motor complex, or the way things move through the GI tract, right? So if things are slower, right, things tend to, SIBO tends to rise, SIBO levels tend to rise. So we also need to think about hypothyroidism with this, because we know that hypothyroidism changes our gut motility and makes our gut motility a little bit slower. That's why one of the main symptoms of hypothyroidism can be constipation in patients. So you want to look at all of these things. With SIBO, it really is important how you test. SIBO needs to be tested with a breath test, and it should be tested with a lactulose breath test. That's because the bacteria are able to utilize that lactulose and then make their gas, and then we measure that gas as it goes through the GI tract. With SIBO, it's something I see super duper commonly in patients, and it's something I see super duper commonly in patients that have had symptoms just forever, and they're not getting any better, and this is something that has been missed. So I think that it is a really important diagnosis, and it really does change things, right? Because we know that our estrobiome, so the way that we metabolize estrogen in the GI tract using our good gut flora, plays a huge role in our hormone metabolism and our hormone uptake. And so we really want to get these things under control. So I want to hear in the comments below if any of this was surprising to you, or if you're noticing that maybe your GI symptoms get worse when your hormones change. And we will see you next week for next week's video.